So my name is Karen Singer. I'm the Chief of Ambulatory Care at Woodhull. I didn't think about it like that, but it's been an amazing experience, and I just feel lucky to have the support from our leadership here at the hospital and from Health and Hospitals leadership in general. And to be able to be here and be a part of all of this has been pretty amazing and emotional, and but really just I feel privileged to be a part of it and to be able to help out in any way. My role through this, one of my main role has been helping to onboard providers who are coming in. And when we heard the Navy was coming and they were bringing so many providers here, it was just a moment of relief and just gratitude. We were really in the throes of what turned out to be right before the peak, what looks like was the peak, and it was truly a war zone here at Woodhull. So knowing that they were coming to help just felt like a little bit off of our shoulders, and like we were getting support coming in. So
It's been.
Sure. So I am not in the units with them, but my job, like I said, was to onboard them. And so what I can tell you is that, first of all, it's an amazing group. They're very patient, and they're very flexible. I mean, when they first got here, we were trying to figure out where the right place was, because we had so much need in our emergency room, in our ICUs, in our inpatient, all across the board, calling families, et cetera. And we just said, where do you feel comfortable? And they said, if you teach us, we'll do it. And it was just uniformly, we haven't done this in X number of years, depending on the particular person, but we'll figure it out. And it was just a complete 100% can-do attitude. And it was just, honestly, it was just easy to work with the whole group. There wasn't a single person that didn't say, well, we'll make this work. I mean, I have to say, and I've been talking to my friends and family, and I've really been in the position where I've been able to see all the people across this country who are raising their hands to come here and help us out. And I'm a little emotional, but it really gets us, it's made me really proud to be part of the medical profession, and to see all the folks who are willing to fly across the country or bike up the street or whatever it is, and come in and help us here, because we really were in crisis mode. And I think just seeing that and all the support that there is just makes me feel like we're part of a larger community and very supported, because it really makes me feel, again, like the community understands and appreciates all the things that the frontline staff are going through. And I try to share it with folks here at the hospital, and send it to other frontline doctors and providers and nurses that I know from across the country who are friends of mine, who I'm sure are also having it in their communities. But it does, again, it makes me feel like part of the community. It makes me feel supported by the community. It makes me feel like we're all going to get through this together. This is a really tragic time in so many ways, but it's just made me realize that together we'll get through it.